So I think it's an interesting question because, of course, the patient-centric takes a little bit of a different meaning when we talk about personalized therapies, because these are some really complex therapies. You can't just deliver them at home or administer them at home. However, I believe that patient-centric patient centricity in personalized medicine means a holistic approach to patient care, where we look at things like a long-term and short-term storage of the patient second doses. You know, most of the, for example, in CAR-T world, most of the therapies have second dose, and it will be stored indefinitely for regulatory, for example, requirements, or as a potential another infusion to the patient. So that will be critical. I think another area is the biobanking or long or short-term storage of patient healthy cells, because at some point this might become a raw material in the future. So we need to take that into account. And I think another important area is bringing the decentralized aspect as appropriate, of course. For example, long-term care at home. So actually nursing support for those patients who have taken, for example, CAR-T therapy, that now are safe and sound at home and cure and doing really well. So we don't have to ask these patients to come back to the hospital for 3 to 5 years to collect the data. We can ensure we have, let's say, nursing networks that are doing that at home, that these patients who have spent many years in hospitals now, you know, can go back and live as normal life as they can. So I think that's really the wider approach to patient centricity in personalized medicine.